Hi everyone. Thank you so much everyone for joining and a very good evening to each and every one of you. I wish and hope that all of you are safe and sound. My name is Rajesh Singh, and on behalf of Future Generali India Life Insurance, I welcome each and every one of you to yet another interactive session. Ladies and gentlemen, today is 4th of February and the World Cancer Day also. Do you know that every year 10 million people die of cancer? Yes, cancer is the second leading cause of death worldwide. However, do you also know that more than 30% of the cases could be prevented just by modifying the lifestyle and also avoiding certain risk factors? Does that make you feel a little happy? On the other hand, unfortunately in India, the incidence of cancer is increasing rapidly. Hence, friends, it is important that we are better aware of cancer prevention, cancer detection, and cancer maintenance as well. Today's session is an attempt from Future Generali India Life Insurance to create cancer awareness and remove the stigma and the fear attached. To help us all recognize the early signs and symptoms of the cancer, we have a very esteemed guest and expert today. And before we bring him on and bring the session alive, let me introduce this special guest. He is a leading cancer warrior since last 28 years. He is also training in surgical oncology as a reputed surgical oncology at reputed Tata Memorial Hospital. He is successfully practicing oncosurgeon and many prestigious awards and accolades that he has got to his credit. Ladies and gentlemen, please welcome Dr. Sanjay Dudhat, Head of Department Oncosurgery at Nanavati Super Speciality Hospital. Dr. Dudhat, I welcome you on behalf of Future Generali India Life Insurance.
Thank you very much for the kind introduction. I'm remembering exactly 1 year back the session at your place. It was very exciting, and I really enjoyed that session also. Today also we'll do something good for the people to give them a good and some practical tips regarding the regarding the cancer point of view.
Thank you, doctor, and so nice of you to have you here again.
It's always a pleasure, because cancer awareness is my passion for last 16 years. I have almost finished more than 450 audio visuals up till now in all places, like right from corporates to villages to slum areas. So that is my passion. Last 16 years I'm doing it, and that is only aim is to do a good awareness which should percolate down to the all parts of the states and countries. That is what my aim is in today and future also at the same time.
Wow! While you're telling this as a mission, doctor, I can see this. The pride on your face with which you're doing this day in, day out.
Always remember, if you don't have any mission, the things will not go to the reach totality. So you have to have mission without any vested interest. That is most important.
Great, sir. Great to have you here. And to my viewers, I would request all of you, while we will be having a set of questions on behalf of everyone to Dr. Sanjay Dudhat,
yes.
I request all of you all to kind of keep posting your questions, your comments in the comments box. and we will be able to view, and once a few basic questions are done in the last 10 to 15 minutes, we will also take viewers' questions also to doctor, so that we can have more relevance of the session coming over to all the users here.
If it is an interactive session, it will be very nice, and it will not be a monotonous thing also for the people, though only I am talking. So question and answers will be ideal. No question about it. Absolutely.
Thank you for that encouragement, doctor.
And I hope my voice is clear to you and other people.
Absolutely, it is clear, sir. I hope I am audible.
Yes, perfectly audible, sir. Clearly audible.
Thank you, sir. Good. So, doctor, we have on our list a few questions which are generally, I think, will bring awareness around cancer as a subject, as a disease. Here is the first thing that if you could clarify, because that will set the entire tone of understanding around cancer, doctor. What are the most common forms of cancer, and what are the causes which you would want viewers to know about?
Basically, this is a very broad question. Okay, so it will take a little longer time to answer for me, but we will go in this way. As we know that cancer is a very frightening word amongst the society, but I'll tell you, this is because this frightening thing is only because there is no much awareness to the people. Cancer is one of the disease like other diseases. Why you should give the undue importance for the cancer when you got such a other diseases which can also have got mortalities and death rates also. But cancer is not well understood with the people. There is no proper awareness about the symptoms, signs, and what is to be done. There is no proper awareness about the treatment. There is always a fear of the treatment about the cancer. And that is why what we need to do and what we are here about is to explain you regarding why you should treat cancer as a normal disease, not give too much of importance and not to have any hype about it. Only thing what you need to have is awareness, alertness, and if you got a symptoms and signs, don't try to wait for a long time. Immediately go to the doctor once you feel there are prolonged symptoms of the same type which are occurring to you. This is one part. Now, regarding causative aspect of the cancer, you know that cancer is not caused by the one single. It is very difficult to have statistics of one particular cause, but cancer is a multifactorial. Now, how multifactorial it is, I'll tell you. As we know that we are in 21st century. Lot of urbanization, rapid urbanization, industrialization, lot of changes are going on in this process. They are polluting the atmosphere at the same time with the chemicals as well as the pollution point of view. Then lifestyle, cancer is a lifestyle disease. How diabetes is a lifestyle disease, cancer is a lifestyle disease. So lifestyle is one of the factors. It includes addictions like tobacco, smoking, alcohol, so many things which are important causative factors for the cancers, hereditary cancers, genetic mutations, and so many other factors. Now tell you there are two more important things. Increasing growth of population also will increase the incidence of cancer. As the population curve increases, the number of cancer patients will increase. And lastly, the longevity of life. During freedom, what was our longevity of life? 47 years. Now, what is the longevity of life? It is 72 years average. So as the longevity increases, as the person grow elderly, immunity goes down, and there is attraction toward the cancer by the body cells because the immunity and overall health goes down. So as the age increases, the cancer incidence will increase. And we normally do this mistake. We don't screen the elderly individuals. We always screen younger and middle age group. And we don't give importance to screen the geriatric people, older age group, where the cancer incidence is going to be little on the higher side. So they are also to be screened properly. There are also yearly has to be examination and investigation to be done properly. I think that is most important. So this is overall is a cancer is a multifactorial, and these are the broad causes of the cancer. Yes, please.
It is really a revelation to know, doctor, that cancer is also related to the increasing population
Correct.
as you have brought out. Uh, Good to know the basic stuff, Doctor. Here is another thing that we would want to know, probably viewers will be interested to know, is we have heard that cancer has various stages of it.
Correct.
And if you could throw a little light on what do you mean by stages of cancer and the relevance of each stage, Doctor?
It's a very good question. Always remember, whenever patient and relative comes to our clinic, and whenever the cancer patient is being seen properly and examined, the first question by the relative or by the patient with anxiety comes, sir, what is my stage or what is my stage of my patient? But they are very keen about it, whether it is a early detection or late detection. But if you see in our country, majority patients are late detected, advanced detection. That is why we have got a problem in India. Early detection in India is only 12.5%. We need to increase this triple or more than that. Because in Western population, diseases are detected in a very early stage than our Indian or East Asian countries. So we have to detect as soon as the cancer symptoms or symptom-like things comes, go to the doctor so that we can detect the cancers early. Now, that is why the cancer stages are divided into 4 stages. Stage 1, stage 2 in one compartment, stage 3 and stage 4 in other compartment. Now, why I am telling you other compartment? Because stage 1 and stage 2 are curable cancers. And stage 3 are locally advanced, and stage 4 is a metastatic. That means all over spread all over the body, which you cannot cure. We can just do a control and prolongation. So your detection has to be maximum in the stage 1 or later, not the late by at least by stage 2. So that more than 95% patients can be cured with an excellent treatment which is available in the world today, including India also. Another thing, in stage 3 and stage 4, even stage 3, 25% of the patient of locally advanced cancers can be cured with aggressive treatment. But remaining 75 and stage 4 requires a palliative, supportive management with either chemotherapy, radiotherapy, or other things. So in India, unfortunately, our death rates are high because more than 70% patients are detected in advanced stages. That is not the correct way of doing it, because majority people outside, forget about villages, in cities they are ignorant about the cancer symptoms. So what we need to do, again I will bang upon, is a cancer awareness should go to all the people. They should know about the symptoms and general signs of the cancers and the treatment outline always required. Number one. Another reason is that we have got financial issues in our country. It's a poor country in majority of the places. So treatment has to be such that it should be available, make available to everybody. So all these things you have to take into consideration. So if the financial availability is there, so you need to increase the level of the insurance also. You have to give awareness regarding medical insurances to the people so that they can be helped in the cancer treatment at the same time. That is also equally important, because as you spread all this, majority people will take the treatment. And poor patient, yes, the government is doing very good job in this particular cases. In 5 years time, they are giving 1,000 crores on the cancer related things in our basically Maharashtra state. So that is how it is. The government has also wants to do certain good things also, and we need to support as one of the Adarsh Nagari from the in India as well. So that is why. So finally, the key to cure cancer is to detect the cancer in early stages. Stage 1, that is our aim, not at least by stage 2, but stage 1 should be our aim.
Thank you, Doctor. And one very important number that I could note, Doctor, that you mentioned is 70% of the patients are late detected cancer.
Correct.
And if that is something,
Need
which
to be
is
addressed.
yes, and if that needs an address, this session that we are having, or this definitely, if more and more people watch around the awareness of cancer, I think we can still bring it down to a great level.
Yes, yes, yes. And we need to put lot of efforts. Everybody need to put, doctors, government, people, and all the people has to be more cooperative to accept this everything. I think that is at most important, because what happens when we tell something to the people, there is always a reluctance and negative mind. Why I should do mammography? Why I should go to the doctor with these symptoms? So trying to avoid to going to the doctor, that he will tell something and we'll have cancer and we'll have long treatment. This is a completely wrong thought. It's a myth. So you are going to damage your body. What happened in COVID? COVID, what happened? Because of the fear, treatments were going on. We were doing the treatment during COVID time very nicely. Last 11 months, I am working in Nanavati Hospital without a break. But people were not ready to come, because some people got early stage to locally advanced stage by waiting for a long time. So because I will get COVID. So what is important, cancer or the COVID? COVID, you can come out, but cancer, it goes advanced, it's very difficult to come out. So we used to literally phone up the patient, please come, nothing will happen to you, we will protect you as far as things are concerned at most possible, but try to take a treatment, because if the stage goes very high or advanced, then we will not able to treat you properly. So this was our experience in last 10 months with the COVID also at the same time. So you should not bother about the diseases like COVID and everything comes and goes. Cancer cannot wait for corona. Always remember that. He's going to have his own road. He's going to follow his own highway path. And finally, once you don't control it, it goes on highway with a high speed. So you need to control that properly.
Absolutely, sir. While early detection will help, doctor, there are predispositions. If you can throw a little more light on how patients can be more aware, what are the symptoms probably that they can, consider before actually thinking that, okay, let me go to a doctor and let me find out, is it like a cancer?
Correct.
What are these symptoms, doctor, if you could throw some light on this?
Very, very good question. I think this is a basic question in regarding the whole of the lecture. I think, what are the symptoms and signs when I should consult a doctor? So there are certain criterias like symptoms and signs. Suppose number one is that any ulcer in the mouth cavity, oral cavity, or anywhere in the body which is not healing. So in such circumstances, don't prolong the thing, consult your doctor. Number two, chronic cough for a long time, which is going for more than 3 weeks, 4 weeks, don't wait. Go to the physicians, go to the chest physicians. It may not be cancer all the time. It could be tuberculosis also, which is treatable. Or even if the cancer, it can be treatable if you diagnose it early. Second thing, any lump in the breast or anywhere in the body. Always remember, ladies come to us for cancer fear is pain in the breast, which is a wrong symptom. The first symptom of cancer breast is painless lump in the breast. Of course, all painless lump in the breast may not be cancerous, but it is one of the things. People feel that pain in the breast or pain in the organ is a cancer. No, not at all. Please take out this myth from your mind. So any lump or anywhere in the body, any bleeding to any orifices, from the nose, from the mouth, vomiting, from the cough, from the rectum, from the vagina, all these things, unusual bleeding, always consult to your treating doctor, either gastroenterologist or for a gynecologist for that moment. So always remember that these are some symptoms. Then chronic constipation, chronic diarrhea. So when it occurs persistently, alternate diarrhea and constipation, you should able to consult a doctor why it is happening very frequently. So these are the important certain signs. Then hoarseness of the voice, which is coming. Sometimes viral fever gives a hoarseness of the voice. But if it is prolonged, why it is happening? Is there any vocal cord problem? Is there any problem in the lung? Is there a problem in the lymph node which is pressing? Yes. Any swelling in the body, don't neglect. It may be benign, but sure to the consult doctor. Now, in majority cities, we have got excellent medical facilities, excellent consultants which are available, excellent doctors which are available, and there is good awareness regarding oncologists also. Of course, I know that very small various oncologists may not reach, but at least they should go to the concerned doctor that he will refer to the major centers to them. So these are all different signs and symptoms of the cancer, general signs and symptoms where you can consult people. Any symptom which is occurring in the body, which is little prolonged and nagging for you, please consult your doctor. Don't treat on your own by doing some odd treatment at home. That is most important.
Thank you, doctor. I think with all the symptoms that you have given, this tagline is very important. All the viewers, I would appeal, please note that anything that is nagging you for a period of time, which is not dying away, and consider you are suffering, please take it forward. Uh, uh, Doctor, while you spoke about some myths in cancer, there are some
Correct.
other myths also
Yes,
associated.
yes. There are a
And
lot of myths. Yes,
yes,
yes. Please carry on.
some of these myths, doctor, if you could, I will just read out. I have kind of researched a few myths about
Yes,
cancer,
yes, yes. You
and
tell me, I'll answer it.
yes, sir. So a few myths that I have that I would want you to look at is like use of cell phone or presence of cell phone towers in the vicinity, or maybe if you are a terrace flat owner, and if you above that there is a I mean a tower, then that can cause cancer is one myth. The second is artificial sweeteners, flavors, colors, or food additives can cause cancer. Or the third one, if you have a family history of cancer, then you're bound to get cancer. People say all these things, doctor. What is your view? Are they really myths? And how should we be reacting to these, doctor?
Now, regarding your first myth that you have said about the mobile phones. Now, the mobile phone means basically it is these are the radiomagnetic waves. Now, up till now, the whole research for last 20 years, we have not come to the conclusion that these radiomagnetics will definitely cause cancer. Not up till now, but there are certain studies which gives the outline that persistent use of mobile more than required for next in 20 years might develop the problems basically for the head and neck areas and causing problem on the brain tumors, head and neck tumors, certain. And apart from that, they can have problems like Parkinson's like disease, then deafness. Mobile use is may cause memory loss. Then all these things are becoming under the research at present, and there are certain certain research are supporting it up till now. But up till now, there is no clear evidence that it can cause cancer. But should we wait till you get the evidence of cancer? I don't think so. So I'm telling you, you can use mobile very judicious. We are using 80% of the mobile usage is not correct, unnecessary. Emergency call, you are not supposed to talk on mobile for 1 hour. And if you want to talk with a meeting and everything, use a speaker phone, use a headphone, which is wire. You can use that. Don't use a Bluetooth also, because it's the same mechanism of radiomagnetic waves. So what you should avoid as much as possible the mobile use unless it is necessary. Don't try to talk to the friends. Yes, how are you? And talk for minutes and hours together on mobile, which is not correct. So use the mobile judiciously. The same thing applies for tower also. So in later on, we might get something out of it, because there is a good research in US and UK, and that has said with this particular thing, with increasing usage, we might get chances of brain tumors and other head and neck tumors by almost 30 to 39% incidence. So this is answer to your first query. Number two, all these artificial sweeteners and additives and everything, all preservatives. There are certain things which are there. They have some carcinogenic effect. But as I told you, cancer cannot be put tick mark that cancer has happened because of this food additive to me. But they are all these factors. That's why I said it's a multifactorial. Whatever external impact occurring on the body, right from your pollution, sunlight, to food adultery, to everything, will have additive effect. And even use of pesticides and everything. Have you seen grapes? A lot of pesticides are put on. You can't even wash that pesticides on that. So many subjects are made on the something wrong water, chemical water and everything. They are going to harmful to the body. So it is not a myth. Yes, it has to be taken care of. Try to avoid all these artificial things in your thing. Number three is there are some other myths also at the same time, which is very important. Cancer is contagious, people tell us. Till the 21st century also in this, in an educated area also, you can see they said cancer is contagious. Cancer is not at all contagious. You can eat in the one thali of a cancer patient, all of it together. There is no problem. There is no spread. With chemotherapy, radiotherapy, everything going on, nothing will happen to anyone. So always remember it is non-contagious. Another fourth myth is that cancer is never curable. Oh, I'm sorry about it. Stage 1, stage 2 cancer are well curable. We have got excellent examples in our whole career of 29 years up till now. I have seen people have got so many awards after the cancer treatment, and they are doing excellently and extremely well. Number 4, chemotherapy and other treatments the patient becomes miserable. Not at all. What it requires is good counseling, good explanation. Of course, they are not a Cadbury chocolates. They will going to have some side effects, but how to have the patience to listen. Always remember, when we go to the mall, eat something odd and have a gastroenteritis and we get admitted into 8 days in the hospital. Do we complain about that food? No, sir. We again after that, we go to that same mall and eat food again back. Now, in this particular context, if you are going to take a treatment properly, small side effects, if you are tolerable, why not to take it? So be positive about the cancer treatment so that it will give the better and better results. There are so many myths. Then deodorants, can we have the cancer? Up till now, there is no evidence. But all these external chemicals, try to avoid to touch your body. So be aware about the fast food. Be aware about the artificial things. Be aware about the preservative thing. Be aware about the processed foods which contains carcinogens. Processed meat contains carcinogens. Plastic bottles contain carcinogens like bisphenol A. All these things you should try to avoid as much as possible.
Thank you, doctor. In fact, you have not just answered the 3 myths, but you have actually added all other things.
They're important, sir. Very important.
Absolutely. So is it that you are kind of saying that stay away from non-organic and stay with organic? Is it also
Correct,
one
absolutely
line?
right. And I'm telling you, organic food to make it available becomes very difficult because they are very costly. It doesn't carry the whole thing. But I'm telling you, the lifestyle 60 years back, I'm telling you, during my birth, I'm talking about 70s, 66, 70s, excellent food, very well cooked food, no preservatives, nothing, all were healthy, sir. You should look at the lifestyle for 50 years, 40 years back, why they were living without any disease. Why cancer was absolutely unheard of that time. I think that is why which is important. We are going 21st century, fine, sir. We are doing advancement, fine, sir. But at the same time, we are abusing our body with all nonsense. I think that we should need to look at. Now, what is happening with the career-oriented life? We are not looking at our own body. You should give 2 hours to your body for the exercise, yoga, meditation, everything, which we don't give. Doctor, I don't have time. Please don't tell me that. There are 24 hours and you can do the best. And if your body is never remain healthy, what are you going to enjoy in the life? And if you buy this wrong lifestyle, if you develop cancer at the age of 40 and 35, what will happen? All career will go in a minute out. So if you want to do that, see, everything has to be under controlled manner. Because what is happening, we are becoming very selfish individuals nowadays. I'll tell you very bluntly, openly, everything we want. I want A, I want B, I want C, I want D, everything. Why not? Why would we sacrifice? No. But that's okay with me. If I don't get it, fine. But why we have that irsha? Kaisa bhi karke mujhe chahiye. No. Keep out yourself. It increases the stress. It increases your body damages. So try to be in such a way that this is my life, this is my capacity, and I will go according to my capacity and earn, and I will enjoy myself. I think that should be the attitude. I think that is more important. Otherwise, new generation, what we need to tell them is the good lifestyle. The whole new generation, I'm telling you, I'm requesting from the Facebook for this thing, all the new generation, please look at your lifestyle. It is not good lifestyle all the time. Why you are interested in the outside food all the time? I think Corona did some side effects on us, but it taught us very nice. I think people ate 6 months at least home food without any complaints. Now, how the home food was good that time? Because there was no alternative outside. That's not the thing. Home food is always the best food for the body because it is cooked with affection. Always remember, these are the something are beyond medicines. So you need to see that your lifestyle, food habits, exercise, yoga. Yoga you are not supposed to do after 60, after retirement, sir. No, you have to start at the age of 15, 16. Then it will give you the best. Meditation. Why not young people can undergo meditation? No question about it. They should do meditation every day. Those samskar has to be started from the school, from 8th standard. In fact, I request for all the government areas also where they are governing the education, they should start all these subjects and bombard on the changing lifestyles and how to make a lifestyle right from the childhood. How many people go to accept tobacco habits in India every year? 1 lakh new students, they develop this habit on an average. It may more, numbers may be more. So all these people starting tobacco at the age of 15 and 16, their life is finished. So having a good lifestyle equally important.
Got it, doctor. I think viewers, all our viewers out there, I can see some great questions coming in.
Please take discussions.
Yeah, just a few moments after this, I will start asking some questions from viewers. Doctor, moving on, while there is a natural, one of the myths attached to cancer as a disease is the stigma attached with the treatment that the patients undergo. So, doctor, for various stages and more about the treatment patterns, if you can throw a little more light on how is cancer treated and why, or what should one do about the stigma attached to it, doctor? How to cope up with?
I tell you, our society has some understanding issues. Why? Because if you look at the tuberculosis in areas of almost 30, 40 years back, it was also stigmata. Arey, isko TB ho gaya. Same thing, arey, isko cancer ho gaya. And that is why it is one of the fear of the cancer patient also. Arey, people will look at me and people will finger me out. And that is why मेरे को कैंसर हुआ मुझे किसी को बताने का नहीं है. Why not? Boldly tell that I am a cancer survivor, I am doing good job. What is the harm in that? Same thing happened in COVID. COVID is what? Viral infection. Was it a achut bimari? No. Then why there was a problem? See, you have to keep away COVID patient just for the spread. But people took it as a different thing in looking at those individuals. I think that society needs to improve in listening to all these things. Please. Don't take the diseases in such a way that you are fingering somebody, which is not correct. Cancer hona paap hai kya? TB hona paap hai kya? Bilkul nahi. Then why stigmata? You should come out of that always and broadly accept these people as your friend and help them from the society, because cancer treatment doesn't reach to all the patients. 60% of the patients in India where cancer treatment doesn't reach. That is our sad state of affair. And that's what we should come together and help this individual as much as possible. That is first thing. The various cancer treatment which are available, right from surgery, chemotherapy, radiotherapy, and hormonal therapy. There are so many therapies now. If you look at surgery, the surgeries are become more better now. 40 years back, there was a concept of radicality, ultra radical operations. Now, when the research came, there is no point, because cancer is a systemic disease. Why to remove the organ radically? Why can't we preserve the organ? So that organ preservation and its function came in picture. Now they are popularized from last 25 years now. Suppose if you take an example of breast cancer, if there is a small tumor, young lady, we don't remove the breast, we just remove the part of the tumor and some glands in the axilla and the surgery is over. Which lady likes a mastectomy or removal of the breast? Nobody will like it. But if you preserve the breast, her morale in the society becomes more upright and she will be able to look at very gracefully in the society and talk. And while mastectomized patient, they are depressed. So organ preservation has done a definitely great difference in the cancer treatment. There are robotic surgeries has come up, laparoscopic surgeries has come up. So many good inventions have come in the surgery. It becomes much better. More high risk patients are going home. More ultra radical operations also are going home with the excellent ICU backup, excellent supportive system. That is more important. Chemotherapy is what basically? They are nothing but the chemicals derived from the plants and other things which undergo phase 1, phase 2, and phase 3 trials, and they are applicable. They are come in the market with a proper safety. Now, there are certain side effects, no doubt about it, but they are all treatable side effects. There are certain, of course, it's a long treatment of 4 months, sometimes 4.5 months, but it is well treatable. It is 3-weekly chemotherapy, and patient becomes more curable by addition of chemotherapy. So, not to worry about the side effects. Hair fall is a big problem with us, but doesn't matter. Even if the hair goes, they come back better than before after the treatment is over. Third is radiotherapy, means lights which are given to the specific organs. It is very safe. Nowadays, excellent machines have come like IGRT, IMRT. So many good things have come up in this way, and that is why we have come into picture this way. Ki radiotherapy will do the excellent job also in cancer patients. Hormonal treatment in the form of tablet, which is applicable to certain hormones. So there is so much of good invention in the treatment. Now in chemotherapy, there is a targeted therapy also has come, which is not a chemotherapy, but it has done wonders in certain cancer treatment. Immunotherapy has come into action with advanced tumors, which is giving you more better life, more increasing longevity. And what is our aim? Finally, considering all the ball game of the treatment, what is your aim? Yes, cure is your aim, but before cure, quality of life. I think that is at most important in all the cancer treatment. If you are not giving any quality of life to the patient, it is of no use. Your cure also has got no value. So you always remember, it is a combination of quality of life and the cure should be aim of your treatment. That is how the cancer treatment has been improving, becoming advanced. It will still become more. Then the cancer vaccines will come. Already cervical cancer vaccine has come in the picture in last 18 years with excellent results of 90% immunity overall in 18 years. So same vaccine concept will go up in certain cancers also. There are so many things are coming up in genetic mutations also. So it's $1 billion research going to come. Every year there will be something new thing. You can hear it, and there will be much better treatment for the cancer also at the same time.
Doctor, it is so reassuring to know that the way treatment in cancer, in the field of cancer, is advancing. There are now, organ-saving, transformations happening, surgeries which are happening. With respect to Dr. Women as a category, and I'm just have a question that probably will help our women viewers, is Doctor, when should a woman start screening for the breast cancer, or what are the symptoms that they should be kind of looking at or paying attention to?
First thing, we'll look at the symptoms of breast cancer, and then we go for a screening. So what are the symptoms of breast cancer? As I told you, pain is not the first symptom. Painless lump in the breast, that is your first symptom and sign of the breast cancer. Then nipple retraction, bleeding from the nipple, or any nipple discharge which is bloody, which is important. Any redness persistent which is on the skin. Skin changes in the breast which are happening, which is very frequently. You have to show this thing to the doctors. Every time skin changes may not be considered to be cancer, but these are the certain things you must know. And that is why we have got a screening modalities which are there for a breast cancer. As we know that there is a lot of increase in the breast cancer in urban part of India. In rural India, cancer cervix is common, but breast cancer in last 2 decades has gone steeply up. And not only that, the young breast cancer patient less than 40, that means 20 to 30 and 30 to 40 are steadily increasing, which is not a good sign. It needs to be properly addressed. So what is being offered as a screening for breast cancer is mammography in a standard low risk individual where there is no family history of breast cancer. Mammography starting at the age of 40, and it should be combined with sonography of the breast. Always remember, mammography, what you see in a mammography cannot see in the sonography of the breast. What you see in the sonography, you cannot see on the mammography of the breast. So they are synergistic together. So you have to do it together. That is one. Every yearly, till the age of 75. We don't know the data further, but if the lady is absolutely healthy enough, they can go up to 80 years also, they can do the mammography. Number two, and mammography has got a very low radiation, so don't worry about that. Number two, this is mammography for breast cancer. Another thing, if they are a high risk individual with family history of breast cancer, mother or mother sister having breast cancer, the daughters of them, they have to undergo mammography and sonomammography starting at the age of 35 at least. Sometimes they may require MRI mammography also because the breasts are dense in that particular ages, but they are in selected cases. And another thing I would always want to give this to all the people is a self breast examination. Give this message to all the women everywhere. We normally start this examination at the age of 20 because we have to teach the daughters first how to do the self breast examination. That is how what we are getting the young cancer can be detected very early. Any abnormal field, any lumpish field, at least you can show it to the doctor. So self breast examination has given utmost importance, and when it is to be done every monthly, preferably 5 to 6 days after the menstruation, when breast is soft and it is easy to palpate. Because before menstruation, breast is engorged, becomes very difficult to interpret. So self breast examination to be insisted on. You have it on the net, lot of videos. You can see how the net breast examination to be done. That is at most important. Again, I'm telling you, the breast examination should be done for the males also. There is a male breast cancer, though it is in a very low percentage, 1% to 2% incidence, but steadily it is increasing, because we used to see once in a year, once in 5 years, few decades back. Now, in fact, myself, I have operated last 3-4 years, almost 7 to 8 patients of male breast cancer. So it is steadily increased, not very high, but male breast cancer also can occur, and if they occur, they are more aggressive than the female breast cancer. So male also has to do the breast chest examination proper, which is also actively important. If the mother has got breast cancer, it may not go to, it may go to the daughter. Definitely, there is a good chance, but it can go to the male child also as a male breast cancer. Also, there is a one of the remote possibility at the same time. So don't be under impression that breast cancer is only in women and not in men. It can happen to male also at the same time. So these are the broader criteria, but insist self breast examination all over right from the age of 20. This is my humble request to all the ladies. Please do that. This will definitely help you in detection of the things, abnormality in the breast at the earliest.
That's quite elaborative, Doctor. Thank you. I'm sure this will help all our women viewers and the men out there. Please be careful. We also need to be a little more careful on what doctor has instructed. Doctor, coming to my next question, we are all living right now in the COVID-19 era.
Correct.
And COVID-19 is strongly associated and a little more serious when it comes to comorbidity. What is your advice for an existing cancer patient or a cancer survivor during this period, the precautions and the maintenance of it, doctor, from your side?
Excellent question. I'm telling you, before COVID, everybody thought cancer is a comorbid thing for the COVID. But I'll tell you, our experience in last 11 months is completely different. Very few cancer patients had a COVID with asymptomatic detection because of we used to give them a test before chemotherapy or before surgery. Sometimes 1 or 2 patients has come positive in between, but they did not have any morbidity or mortality in our last 11 months in our hospital. We got a completely different, with I think during chemotherapy also patient came COVID positive. We stopped chemotherapy, waited, treated, again started chemotherapy. Patients are healthy and hearty. Not a single patient of cancer patient had whenever they had a COVID in a very small percentage, very small percentage, less than 1% I would suggest, but they did not have great morbidity or anything leading to mortality at all. So how can we say it is a comorbid condition? We think that it is which is a immunosuppressive or anything, but we have got a very different this thing. I think possibility that they must be taking utmost care not to come in contact with the people and everything. I think that is a hitch proper for the COVID to prevent as much as possible. Whenever you are loose in COVID, when you are not wearing the mask, when you are not taking the precautions and everything, that's why people have landed up into issue. Diabetes and other issues, yes, there are comorbidity, but cancer per se, we did not find great effect on the COVID patients at all. That is our observation. So not to worry. That's why I always told all the patients, cancer cannot wait for corona. You may come out of the corona, but cancer, if you don't treat, it becomes very difficult to come out.
And some real encouraging statistics. Very glad, doctor, to understand that the numbers that you have shared are that people with who are survivors, who are undergoing the treatment, should go out and continue their treatment rather than
Correct. That's
rather than sitting at home or fearing about it. Great. Doctor, the other aspect of it is the maintenance of or the cure or the financial angle of cancer as a disease. Doctor, what is your advice as far as today, there are health insurance policies or there are insurance policies. What is your advice as far as cancer and insurance is concerned, doctor? If you want to,
I'll tell you one thing. I always tell that how we want to do cancer awareness. At the same time, there are financial issues, no doubt about it. And without that, it becomes very difficult to treat cancer. It requires longer treatment. So finance is little on the higher side, no doubt. Everybody cannot afford that. So the awareness of this insurance also everybody should able to know. So it should go to the every person, whosoever wants and whosoever can afford to take that premium. They should take it because they are covered with that. So that if anything, forget about cancer. In any other ways, accident occur, anything occur, it becomes an easy way to go ahead with that. And they will have some sort of support that I have got something, so they will not be deprived from the treatment. So cancer insurance is one of the things. NGOs should work in a very strong way so that they can also support the patient in some things. Hospital, they are doing the very good job for poor patients, including our hospital. There are certain poor patients are even treated free also in those category of very poor patients. No question. Every hospital, big institution, they are doing it. So maximum help is going on, but still more help is required. How much is our insured patients in our country? Very few. So that needs to be propagated properly. And people think that why I should take an insurance? Why I should waste money? But they are going to be helped definitely in this particular aspects, and they will be able to get the treatment properly with all this. That is what my suggestion to all the people.
Thank you, doctor. I think that also brings in a fair chance of economic support as far as cancer treatment is concerned. Doctor, I think you have fairly covered the subject. I think it's time that we go to our audience and probably pick up few questions from there.
Please pick up the questions.
Yes, sir. So I can see a few questions which have come up from audience. Doctor, I'll just put a few questions. There is a viewer who has asked that in his family somebody has underwent a mouth surgery.
Yes.
And it has been advised by the person who was actually examining for 30 sessions on radiations for the same. However, it is economically not viable for that person to go through such a hefty amount. Maybe. So is there any ways or any centers probably who are doing this at a lesser cost or something, doctor?
Now, listen, basically, majority oral cancers, normally we get in advanced stages, stage 2 and stage 3. And they all require a proper radiation postoperatively because if you don't give that, the recurrence chance will come, and the disease will come back. Now, the choice of the treatment in the hospital is according to the affordability of the patient, no doubt about it. But there are hospitals like Tata Memorial Hospitals and other hospitals. There are some charitable hospitals which have got a radiation machine. They can approach that and then they can take the radiations. Unfortunately, we have got a very lesser radiation machines in India. We need to have almost double what is required right now. We have got only 400 plus radiation machines right now. They should go more than 700 plus. Cancer centers also, they should increase. We have got only 300 plus cancer centers, proper comprehensive center. They should go at least double, that is 600 plus cancer center, to give the treatment properly. And at the same time, as government has done a very good job, they have decreased the rate of oncological drugs also. I think they will still further do it to make it little affordable as a chemotherapy and radiation. Also at the same time, I'm very sure about it. And there are certain hospitals which are basically help in charitable way. Like another thing is Tata Memorial Hospital also centers are doing good job. So such hospitals are there, and they can take a help of NGOs also at the same time.
Thank you, Doctor. Doctor, another viewer, while you have already touched upon a few things as far as lifestyle is concerned, I think prevention in any case is better than any other option. So, Doctor, can you throw a little organized way of, how, what are some food habits or what are some, other living related habits that we should either do or don't? What is other than what you?
Very clear
is there
statement.
any regime? Is there any regime that our people should follow? We should follow.
It's basically not the regime. They should understand all the aspects of prevention is very important, and not only asking the question enthusiastically as a prevention. It has to be followed and executed. It is not listening to Dr. Dudhat, what he has said about the prevention. If it is not followed in the life of a person who has asked the question, that is also not correct. So what they need to understand, prevention has to be followed. So prevention is better than cure. What we can do is stopping the habits of tobacco, smoking, alcohol. Alcohol cannot take in moderation? No, sir. Alcohol can cause 12 types of cancers in the body. So it should not be taken. That is what I will give my advice. I always do anti-tobacco, anti-smoking and anti-alcohol advice because they are bad for the health. It's nothing like that I'm taking occasional. Occasional means you cannot have a definition of occasional. So stop all this. Number two, have a good exercise every day. 1 hour to 1.5 hours or good exercise every day will decrease the chance of incidence of cancer by 25 to 30%. Yoga meditation will add to this percentage by relaxing your mind. Of course, only yoga cannot prevent, but yoga will add to the prevention. Always remember that. And it should be started at the younger age, not after the age of 60. Don't tell us that we don't have time. 2 hours should be given to the body. Eat good food, eat home food, eat well-cooked food. You should test outside food once in a while. But every day you are going out and eating something which is unnecessary taste bud stimulation of the tongue, which is not correct. Don't eat fast food. It is not going to give any good thing for your life. So good food, nutritious food, good amount of proteins for the body, you must take it and see that which is good for you, which is bad for you. Mobile phones, use judiciously, use whenever it is required. So these are all the things you must take into consideration. Always remember, life is very good. Life comes once in a thing only. So you have to enjoy the life. And to enjoy the life, what is important? Your health. Health is wealth. If your body is not able to cope up with the things, you cannot do anything. Even if you have got tons of money, you will not be able to enjoy. So whenever you are young, if you have this stability of good lifestyle, because in young we thought that nothing will happen to me, but always remember these damages occur 20 years of constant happening damage to the body later on. So you have to keep avoiding this damage right from your childhood, younger age group, so that you can live even 80s without disease. Don't you think this is important? Diabetes, hypertension, they're coming at the age of 25, 30 because it's a bad food habit. Obesity is a disease. So don't eat many fat foods and become a very fatty individual. That's why postmenopausal women, why they get cancers like uterine cancers and ovarian cancers and breast cancer? Because extra fat which is occurring in their body gets converted into estrogen. All these cancers are estrogen dependent hormone cancers, and that is why they have got more chances of having cancer in their body. So obesity, sthulata, it is bad for the health. So, and good thoughts. Always remember, if you have good, stable thoughts in the body, which you have, then you will always have good lifestyle. Listen to good things in the life. See, and it's बहुत अच्छी कहावत है. सामने देखो, अपना लाइफ इतना अच्छा है, you can able to, and अपना लाइफ का जो गुरु किल्ली है, तो अब हमें देखना है कि हमारा बॉडी सुदृढ़ कैसा रह सकता है. That is at most important. Must have this prevention proper and follow it properly. Always don't listen for the Facebook show. Don't listen. Dr. Dudhat is saying, listen, aha, Dr. Dudhat has spoke superbly well. But it has to be followed, followed, and followed. And what I am talking, I am following the lifestyle proper. No addictions, nothing in the life. I think that is more important to give you upright advice from my side to you in a very it's a very properly manner, so that confidently I am telling you, you should avoid all this. That is very important.
Thank you, doctor. And the way you are talking, the passion with which you are actually, giving us the way of life ahead to prevent cancer as a disease. I think it should motivate each and every one of us here, or whosoever watches, to actually, stay away from the bad habits, or, actually embrace the right habits.
And one thing I would like to suggest you also, all these webinars and everything, you should go in the young college years. I have covered almost 22 colleges in Mumbai up till now in so many years. I think those kids, that age between 15 to 22, they require a very good education. If their lifestyle goes proper with a proper samskar, I think this thing will go down, and I'm very sure about it. And they should teach how to cope up with the stress, because they think that if the stress, I will smoke, and with the smoke my stress is gone. I take 2 pegs of alcohol, my stress is gone. It is not correct. They are not going to give any good in the life. They will always damage your body. 10,000 diseases from these 3 things. Please avoid. Less stress, listen to good music, have some good hobby, read something. Because of the mobile and WhatsApp, we stopped our reading habits. We stopped going outside and there is no place in Mumbai like thing to do any work on the ground. So these are deficits in our society. So if you are not able to play, if you are not able to read, then you are going to undergo stress, and develop these habits and get attracted toward this. Always remember, never allow these wrong things to acting on your brain. Your brain should be yours own. Nothing should act.
Previous answer, doctor, whatever that we consume is very important, whether it is the thoughts or whatever that goes in the brain or whatever that goes in the stomach has to be pure. So it has to be well selected, is what I have learned. Doctor, more or less, I think the audience questions are through. We are through with it. Doctor, as a parting comment, anything else that comes to your mind, doctor, that you would want our people out there to kind of be very passionate about, or maybe be very careful about, doctor? I think you broadly cover everything almost. But
I would like to tell you one thing for viewers. Always remember, don't have any bad addiction in the life. You should have addiction of only one thing in your life, is good work and good passion of good things. These are the 2 things you should follow. Always remember. Why I'm saying good thoughts? Without good thoughts, you cannot improve your lifestyle. Unless your brain is stabilized, you mentally stability, you cannot follow good lifestyle. So you should learn how to cope up with the situation in a graceful way. That is how I would always give this message to everyone. Be strong. Life is always turbulent. Everybody cannot be best in their life. There will be turbulence, but you must know how to handle that turbulence mentally, physically, and with everything with a grace. Always remember this word, with a grace. Anything happen, I will stood behind everything and I will do the needful accordingly. Whether it's odd, good, or anything, I will do the best. That is what I normally want to give the whole message and this message to everybody.
Thank you, and such a powerful message, Doctor, that you are actually parting us with. Doctor, I think we are more or less done. I think I must thank you, Doctor, once again for your presence here and the kind of awareness that you have actually brought in our viewers, and future viewers also will watch this. I am sure that this will help the world reach a better informed stage as compared to what we were, sir. Yes, you want to say something, Doctor?
I want to say thank you to Future Generali, all the staff, for having a very good gesture for the cancer awareness. I have done it last year also with you. I think every year we should do it for the viewers as well as to this. This is a good gesture as a good social work for the society. That's what I feel. And I thank Nanavati also. We are done with the collaboration together. So I got this opportunity because of Nanavati and our admin, and with you also. I'm thankful to both of you. And as I said, whenever you call me, I'm always ready for this because that is my passion. I will continue till I'm alive for this.
Thank you so much, Doctor. In fact, on behalf of all our viewers and on behalf of Future Generali India Life Insurance, I once again thank you so much. In fact, it is my pleasure to be with you, Doctor, and more so because back in life, roughly around 7 years, I have been in pharma industry. Those were the days when I used to be interacting with doctors day in, day out, and now after almost 2 decades that I am again back with a prestigious oncosurgeon like you, Doctor. It gives me great pleasure to have you here. Thank you so much, sir.
And lastly, I would like to give one slogan: I am and I will. This is our World Cancer Day slogan. And I would suggest one slogan. It is from our all oncologists: fight cancer regardless, must treat, must fight.
Wow, what a powerful message, Doctor. Thank you so much, Doctor. Thank you very much.
Thank you very much. Thank you.
Thank you, sir.
Thank you.